Senator from Oregon.
Mr. President, Senator Klobuchar has said it very, very well, and I want to pick up on her remarks. And we're here to reflect on the extraordinary achievement in the Inflation Reduction Act in order to provide for the first time a real measure of relief, for the staggering costs seniors and others pay for medicine in our country. And I'm going to talk about the negotiation issue, but I want to say this is just the next and essential piece of what we are doing to get relief for the consumer. For example, through most of the summer, Mr. President, I talked about the price gouging penalty that we got in the law. And I see my friend Senator Stabenow, my colleague who's been my seatmate on the Finance Committee. We sure wish she wasn't retiring. But the price gouging penalty is the first such thing in federal law. This is a penalty that it's imposed, as Senator Stabenow remembers, when drug companies hike their prices over inflation. They have to pay a rebate to Medicare, which is used to lower the out-of-pocket costs for seniors. And Senator Stabenow and I have been out kind of crunching the numbers on this issue, and one of the areas that we found is that these drugs, particularly those that are administered in a doctor's office, already are producing massive savings. Senator Stabenow, we found a drug a couple of weeks ago where seniors are saving several $100s per dose. Per dose. I would say to my colleagues, on one of these cancer drugs you get in the office, and this is just the beginning, as Senator Klobuchar has said. So this legislation, which didn't unfortunately get a single Republican vote, represents a seismic shift in the relationship between consumers and Big Pharma, and especially authority for Medicare to negotiate prices of prescription drugs with manufacturers. And I just want to take a few minutes to pick up on this issue of the barrage of legal actions Big Pharma and their allies are taking to stop Medicare drug price negotiation. And we've been talking about all these lawsuits that the big companies, and I gather the Chamber of Commerce is with them all the way, have filed to prevent seniors and families from getting a break on medicine. So these legal actions that the big companies and the Chamber of Commerce are taking beg the question that I just want to offer up this afternoon. What would happen in America if our country didn't negotiate in our economy? The fact is, negotiating on price is the underpinning of the American marketplace. It ensures you bring two sides together to get a fair deal. And the question really has to become, are these companies that have filed these suits really arguing that the government shouldn't try to get a fair price on medicine for more than 50 million American seniors? Senator Stabenow, that is the essential question. Are they really arguing to the American people? And by the way, this is taxpayer money. Much of this is taxpayer money. Are they really arguing that seniors and taxpayers shouldn't get a fair deal? Now, the fact is that Medicare, in particular, with such strong taxpayer backing, has a special argument for being a program that we negotiate to get fair prices on. Because Medicare is not just a slip of paper. As we've examined in the Finance Committee often, I see Senator Whitehouse, our distinguished colleague. Medicare is not just a slip of paper with a few words on it. Medicare is a guarantee. It is a guarantee for seniors of good quality coverage. And it just begs the question, if you have a guarantee, and a guarantee of something specific, good quality coverage, wouldn't you automatically say that the taxpayer should be able to have a friend and advocate negotiating for them in order to get the best possible deal? And I think the answer to that question is pretty obvious. Now, Big Pharma has unfortunately taken a very different position. They have been guarding the prohibition on price negotiation in this country like the Holy Grail. And they don't like that we have closed this chapter. And the first 10 drugs were not drawn out of a hat. Congress made it clear in black letter law the criteria the federal government has to use. And so what we're doing now, Senator Stabenow, we've been talking, I think, to many of the members of the Finance Committee, is we're looking at the fact that these 10 drugs also were ones where we made sure and put in the criteria specifically where you had significant taxpayer support in terms of getting the drug to market. So again, another argument for why you ought to negotiate the costliest drugs and drugs that get to market with taxpayer money. Now, Senator Klobuchar, I thought, very eloquently described a number of the drugs, but I think, and I want to give my colleagues a chance to make their remarks, I think we ought to reflect on the importance of making sure that when Big Pharma has been double dipping into taxpayers' wallets for these important medications, groundbreaking research from the National Institutes of Health or another research arm of the federal government, then after the research was funded by taxpayers, manufacturers sell the drugs developed using taxpayer-funded research back to taxpayers at sky-high prices. Are they really not going to have a chance to get a better deal? Enbrel, which is a drug we've mentioned often on the floor, was discovered at a Massachusetts General Hospital using NIH-supported research. The hospital sold the patent rights to the drug manufacturer that has profited off Enbrel at the expense, Senator Stabenow, of taxpayers for now going on 30 years. So my colleagues are going to have a chance to go into further detail about this. But I think when you're talking about Big Pharma and a new law that considers, among a host of other factors, prior federal financial support provided by the taxpayers that we have the honor to represent, it means that the government should stand up for seniors and taxpayers to make sure that they get a good deal. An investment in basic science funded by American taxpayers is, based on our record in the Finance Committee, often the foundation of a new drug. And when drug manufacturers use this taxpayer-funded research to make a drug, the price of the drug should be lower to reflect taxpayer investment, and you get the best possible deal for those taxpayers when you negotiate. And I will just close by saying, I think my colleagues know from talking to people at home, most people, when you discuss this issue, think it's absurd that for all these years, nobody could negotiate for them. What they're surprised about is not so much that a law passed, even though Senator Klobuchar talked about beat all these lobbyists. What they're surprised about is how people with a straight face have made the case for years that with all of the taxpayer support for medicine that I just outlined, that you wouldn't have started negotiating for taxpayers and seniors a long time ago. So I really appreciate Senator Klobuchar doing this. I see the chair, who's been our champion in the other body for many years, my seatmate, Senator Klobuchar. We've got an exciting new member from the West who's also joined us. This is an important chance to really think through where we're headed. And Senator Stabenow knows we got a lot more to do. We're taking on the PBMs, the middlemen, who are also a factor in driving up prices. But tonight is a chance, because Senator Klobuchar has taken this time for us to outline what the negotiation issue is all about. And I've tried to go through some of the history about how you were stunned to hear over the years that you couldn't negotiate. That's been changed. My colleagues are going to continue this discussion, and you're going to hear a lot more about it, because for all of those people that I knew, starting with the Gray Panthers, who were standing in those pharmacy lines, getting mugged at the pharmacy counter, trying to figure out how they were going to choose between their food and their rent, they're going to have new hope, because prices are going to be negotiated. There's going to be hope for them, and there's going to be hope for American taxpayers, and it's long overdue, and I yield to my colleagues.